move on to longus colli muscle. And we're going to use a lateral approach to access it. So the same steps we use to get to the anterior scalene, pushing the SCM out of the way, turning our fingers in and sinking in between the SCM and those transverse processes. Now, instead of staying on the tubercles of the cervical spine, we're going to keep moving medially. So I'm going to move towards the midline. And in order to do that, you definitely need the head side flex slightly to allow for that penetration. You're not yet applying any pressure. Just try to wiggle your finger between the SCM and the cervical spine, creating a bit more space for your fingers. Now, once you reach as far medial as you can, then you apply your pressure anterior to posterior into the vertebral bodies. So you can see my fingers pressing downward into those vertebral bodies. Here we are on the longus colli in its most lateral aspect. And you might notice that the pulse of the carotid artery is above your fingers. So you might feel it with the nails of your fingers, which means it's completely out of the way and safe for you to be in that spot. Now here, there's a limited amount of space for you to move, so your circular frictions are going to be quite small. Keeping that anterior to posterior vector, you're going to slowly try to slide inferior on the muscle. So trying to affect most of its length as you circle around back and forth. Keep the circles nice and small so you don't lose your spot on the vertebral bodies. And as you move inferiorly, you'll see that flexing the neck, the head off the table passively will help you continue inferiorly as far as C7. So one more time. Side flex. Move the SCM out of the way, find a little spot between SCM and the anterior tubercles, sink in medially, then apply your pressure posteriorly, and then do your slow circular motions, moving down the muscle, bringing the chin in, and lifting the head off the table.